Today, I will be doing a urinary catheter on my patient, Mr. Johnson. This catheter has been ordered since he has been experiencing some urinary retention. So I'm now going to enter the room. Hello, Mr. Johnson. My name is Larry Stark. I have closed the curtain for privacy. I will be performing your urinary catheter today. Would you like to show me your wristband and confirm for me your name and date of birth? Perfect. All right, I'm going to lower this now. All right, so this procedure is going to start with pericare. This is going to include me having to clean off your genitals. So, are you comfortable with that? Good. All right. So now while I'm getting this ready, have you been experiencing any pain and discomfort outside of the urinary retention you've been experiencing? Good. I'm glad to hear that. All right, I'm gonna roll this down now. You can access. All right, I'm going to lift up your gown now. All right. So right here, I have a basin filled with warm water and soap, and I will use this to perform pericare. All right, so now I'm going to use this part, clean around that side, move this part, clean around that side, move to another part, down the side, part, down the side, another part, down the side, and lastly, down that side. All right, set that back in there. Now I'm just going to dry the area. Okay, there, move this here and out the way. All right, that's pericare taken care of. I'm now going to move on to the Foley catheter. Are you comfortable with this procedure? Good. All right, so now I'm going to just pull your knees up, bring it into a working position. Stretch your knees out a little bit so I have room to work with. And now we're just going to apply this in advance. I find it easier to do before the sterile field is set up. All right, I'm going to start working on preparing my sterile field now. If there's anything you need during this procedure, feel free to let me know. So I'll start this, moving this paper out the way and turning this plastic bag into a makeshift garbage bag that will be used for this procedure, because there will be many things that will be thrown away. So I'm going to start undoing this. Side, grab this side, pull it out, turn it, pull it out. I'd spin it some more, but that side's already out. And now I'm going to grab my gloves. Well, if they were still packaged, unlike how they are now, I would just open them up like that away from me. So now I'm going to grab corner, pull out to the side. I'm sticking in the margins. I'm going to move my way to the other corners and then pull those out as well. Form a crease so that these should no longer fold back in on themselves. This close. Bring it up, bring it up in the air. Use the scoop method. These gloves. Where's the cam on this side? Those over here. Sterile gloves are on. That package isn't in my way, so I do not need to remove it immediately. This here is our fenestrated drape. I have not required to use this as per hospital policy, so I'm just going to discard that for the time being. Now I'm going to take up this drape. Grab this, slide it. With a non-mannequin patient, I would have them lift their butt so I could slide this under a little bit, but it's not an option. So I'm just going to move it as close to the area as I can. And then I will grab this one. Similar story, shiny side down for both of these. Bring it in between the ankles and legs as such. And then we'll set this here. set this here. Do you have any allergies? He has an allergy to iodine, so I will just go ahead and remove my iodine in advance, just to save myself later. This is the urine collection sample. A urine sample can be taken out of the Foley bag only immediately after a Foley has been inserted. I'm going to set that off to the side. I'm going to remove this plastic covering from our Foley tube, grabbing onto the tip so it doesn't fly around. Set that in there. We'll now attach my saline syringe to the port, this little green thing right here. Just set that in for now as a preparatory step for later. So now I will just move the hydrogen peroxide a little bit, tear a lubricant, apply a long strip of it, and discard it because male patients require 5 to 7 inches of lubricated catheter due to the longer urethra. Work with me. There it goes. Okay. So now that that's prepped and ready to go, I'm going to take my hydrogen peroxide, rip it, pour it over all my cotton balls, discard it. And now, only using this hand, I will grab the shaft of the penis in order to control it. And I'll take cotton ball around and down. Cotton ball around and down, separating penis into quadrants, around and down, around and down. All right, don't need that anymore. It is all 4 quadrants of the penis taken care of. Just go ahead and get that a little bit ready. So now with the 5 to 7 inches of this lubricated, I'm now going to start inserting it down the urethra. I would, this could be uncomfortable, and I'm going to ask you now to bear down as if you're trying to pee. And let's go. Okay. So I do not stop immediately after I see urine return, because that does not necessarily mean I'm in the bladder. So I'm just going to push it in until I feel resistance, which means I should have reached the end of the bladder. I'm now going to push this in, going slowly. Don't want to pop the balloon inside. I'm going to keep some pressure on the plunger and remove it quickly. Set that off to the side now. Just going to tug on this. It's in there. All right, so now I'm going to do this part next. I'm going to make sure to give a little bit of slack so when the patient's leg goes down, there is no discomfort. All right, so now this is in here. I will attach this to a movable part of the bed, and this is where I would take a urine sample if you're doing that, using that cup there. So there's a hook right here, and I'll just go ahead and attach it to that hook. So now the male urinary catheter is in. At this time, I would ensure my patient has access to a call light, see if they need anything. But since we are moving right into the removal process, I will remove the gloves, perform hand hygiene, and then bring on a set of clean gloves. This part of the procedure does not need to be sterile. All right, hello, Mr. Johnson. I am now. Whoops. All right, gloves go in the garbage. I am here to remove your urinary catheter. How are you feeling? Are you experiencing any pain, discomfort, or any other symptoms? It's great to hear. At this time, after I get these gloves on, I would take a graduated cylinder and remove all the contents in the Foley bag. There are no contents, and I also do not have a graduated cylinder. So I'm going to remove this bag, bring it here, undo this. Let's see, where is this? Alright, I'm now going to remove the urinary catheter after I remove the saline. Now, gravity alone should be able to do this. If the flow stops for any reason, I need to call a physician to address that. But it looks like it is flowing smoothly. So I'm just going to give this a minute. So I'll just ask now, Mr. Johnson, would you like to perform pericare by yourself, or would you like to have me do that for you once I am done removing everything for the catheter? You'd like to do it yourself? That's great. We like to promote our patients to take their own health and wellness into their own hands when we are treating them. So, all that's out. All right, I need you to bear down like you're trying to pee as I remove this. I'm gonna try and make it quick so it's not too uncomfortable. 3, 2, 1. There, now I'm gonna grab by the tip just to make sure urine doesn't start flailing around everywhere. So now I'm going to grab all this. Now at this time, all the contents would be thrown away, but we reuse materials. So I'm going to remove these gloves, perform hand hygiene, clean up my area, and then give the patient all the items that he needs to perform his own pericare. So with that, Mr. Johnson, thank you for your compliance in this procedure. I hope I did not make it more comfortable than it had to be for you. I'd lower the bed and bring up the rail, but after he's done his own pericare. But since I'm done with the removal, this concludes this procedure.